Hey everyone, welcome back to the Dr. Sarah Mitchell channel. I'm Dr. Sarah Mitchell, and if you're new here, don't forget to hit that subscribe button and turn on notifications so you never miss our latest urology insights. But before we dive in, I need you to do me a favor. Check the first comment below and our description. I've linked a premium prostate supplement that has genuinely helped thousands of men over 70 maintain their urological health. Trust me, you'll want to see what we're recommending. Now, today we're tackling something that literally keeps millions of men awake at night. And I'm not talking about insomnia from stress. I'm talking about the medications that doctors would never give their own parents. Stick around because what you're about to learn could literally change your life. Here's the truth that nobody wants to talk about. The pharmaceutical industry isn't designed to make you healthier. It's designed to keep you dependent. And when you're over 70, the stakes are even higher. I've spent 15 years in urology, and I've seen firsthand how certain medications that are prescribed every single day, are actually making men's conditions worse, not better. Today, I'm going to reveal 5 medications that I would never recommend to my own parents, my own family members, or anyone I care about. These aren't fringe drugs. These are mainstream medications that millions of men are taking right now, thinking they're helping them. But the reality? They're often creating more problems than they solve. Before we get into the specific medications, let's talk about why this matters. When you're over 70, your body isn't the same as it was at 40. Your kidneys work differently. Your liver processes medications differently. Your metabolism has changed. But here's what most doctors don't tell you. They're still prescribing medications based on the same dosages they'd give to a 45-year-old. This is called polypharmacy, and it's an epidemic in senior healthcare. The average man over 70 is taking between 4 and 5 prescription medications. Some are taking 10, 12, even 15 different drugs. And here's the kicker. Most of these medications were never tested together. We don't actually know how they interact with each other. I've had patients come to me with what they thought were new health problems, only to discover that their new symptoms were actually side effects from their medications. A man comes in complaining about erectile dysfunction, and it turns out his blood pressure medication is causing it. Another man has chronic fatigue, and it's because his prostate medication is interacting with his heart medication. This is why I'm so passionate about educating men about what they're actually putting into their bodies. You deserve to know the truth. Let's start with alpha blockers. Now, alpha blockers are commonly prescribed for benign prostatic hyperplasia. That's an enlarged prostate. And yes, they can help with urinary flow. But here's what doctors often don't mention. They can cause severe dizziness, fainting, and something called retrograde ejaculation. Retrograde ejaculation means your semen goes backward into your bladder instead of out through the urethra. For many men, this is devastating. It affects their sexual function, their sense of masculinity, and their quality of life. And the worst part? It's often permanent, even after you stop taking the medication. I had a patient, let's call him Robert, who was 72 years old. He came to me complaining that he couldn't ejaculate properly anymore. Turns out, his doctor had put him on an alpha blocker 5 years earlier, and nobody had ever told him this could happen. 5 years of sexual dysfunction because of a medication side effect that could have been prevented. Now, I'm not saying alpha blockers are always bad, but there are alternatives. Natural approaches to prostate health that don't come with these devastating side effects. And that's exactly why I've partnered with a premium supplement company to create a solution that addresses prostate issues without the pharmaceutical risks. Next up, diuretics. Doctors love prescribing diuretics for high blood pressure and heart conditions. They work by making you urinate more, which reduces fluid in your body and lowers blood pressure. Sounds logical, right? But here's what happens when you're over 70. Diuretics can cause severe electrolyte imbalances. Your body needs potassium, sodium, and magnesium in specific ratios. When you're constantly urinating, you're flushing these critical minerals out of your system. And when your electrolytes are imbalanced, everything goes wrong. You get muscle cramps, you get weakness, you get confusion and cognitive issues. I've seen men in their 70s prescribed diuretics who suddenly developed what looked like early-stage dementia. Their families were terrified. But it wasn't dementia, it was a medication side effect. And here's the really insidious part. Most doctors don't monitor electrolyte levels regularly enough. They prescribe the diuretic, maybe check your levels once a year, and that's it. Meanwhile, your body is slowly becoming depleted of the minerals it needs to function. Statins, Oh, statins. These are some of the most prescribed medications in the world. And yes, they can help lower cholesterol. But the doses that many doctors are prescribing to men over 70, they're often way too high. High-dose statins can cause something called statin-induced muscle myopathy. That's a fancy way of saying your muscles start breaking down. You get weakness, pain, and in severe cases, kidney damage. I've had patients who couldn't walk upstairs anymore because of statin side effects. But here's what really bothers me. There's growing evidence that cholesterol isn't actually the villain we've been told it is. In fact, some studies show that men over 70 with slightly higher cholesterol actually live longer than men with very low cholesterol. Yet doctors are still aggressively lowering cholesterol in elderly patients, often causing more harm than good. The pharmaceutical industry has spent billions convincing us that cholesterol is the enemy. But the truth is more nuanced, and when you're over 70, the risks of high-dose statins often outweigh the benefits. Now, I want to be careful here because depression is real, and it's serious. But certain antidepressants, particularly SSRIs, can cause sexual dysfunction in men. And I'm not talking about a minor decrease in libido. I'm talking about complete erectile dysfunction and inability to ejaculate. For men over 70, this is particularly problematic because sexual function is often one of the last things that makes them feel alive, feel vital, feel like themselves. Take that away, and you're not just treating depression, you're creating a new problem. I've had patients tell me that the antidepressant helped their mood, but it destroyed their sex life. And when I ask their prescribing doctor about alternatives, they often say, well, that's just a side effect you have to accept. But that's not true. There are alternatives. There are different classes of antidepressants that don't have these sexual side effects. The problem is that SSRIs are cheap, they're well known, and they're easy to prescribe. So doctors prescribe them without fully discussing the sexual side effects with their patients. It's a disservice to men's health. Finally, let's talk about certain prostate medications, specifically 5-alpha reductase inhibitors like finasteride. Now, these medications can help shrink and enlarge prostate, but the side effects? They're significant. These medications can cause erectile dysfunction, decreased libido, and something called post-finasteride syndrome, where men experience persistent sexual dysfunction, depression, and cognitive issues even after stopping the medication. And here's the scary part. We don't fully understand why this happens or how to treat it. I've had patients who took finasteride for a few years, stopped it, and still can't get their sexual function back. That's a permanent side effect from a medication that was supposed to help them. And again, there are alternatives. Natural approaches to prostate health that don't come with these risks. That's why I'm so excited about the supplement I'm recommending in the description. It's been formulated specifically to support prostate health without the pharmaceutical risks. So what's the solution? How do you maintain your health over 70 without getting caught in the pharmaceutical trap? First, you need to understand that your body is different now. You need a different approach. You need medications and supplements that are specifically designed for men over 70, not generic prescriptions that work for everyone. Second, you need to focus on the root causes of health problems, not just treating symptoms. An enlarged prostate isn't just something that happens randomly. It's often related to inflammation, hormonal imbalances, and nutritional deficiencies. Address those root causes, and you address the prostate problem. Third, you need to work with healthcare providers who understand that more medication isn't always better. You need doctors who are willing to de-prescribe, to actually reduce your medications when possible, rather than just adding more drugs. And fourth, you need to take control of your own health. You need to educate yourself. You need to ask questions. You need to understand what you're putting into your body and why. This is why I've partnered with a premium supplement company to create a solution specifically for men over 70 dealing with prostate issues. This isn't just another supplement. This is a carefully formulated protocol based on the latest urological research. The formula includes ingredients that have been scientifically shown to support prostate health, reduce inflammation, and maintain healthy urinary function without the side effects of pharmaceutical medications. I've recommended this supplement to hundreds of my patients, and the results have been remarkable. Men are sleeping through the night again. Men are maintaining healthy sexual function. Men are taking control of their health instead of being controlled by their medications. And here's the best part. It's affordable. It's only $29, a fraction of what you'd pay for prescription medications. And it comes with a money-back guarantee because I'm confident it's going to work for you. So here's what I need you to do right now. Check the first comment below. I've pinned it to the top of the comment section. You'll find the link to the supplement there. Or check the description. The link is there too. Click that link and order your supply today. But don't just take my word for it. Read the reviews from other men who've used this supplement. See the results they've gotten. And then make your own decision. Now, I want to be fair to my colleagues in medicine. Most doctors aren't trying to hurt their patients. They're doing what they've been trained to do. They're following guidelines that were created by pharmaceutical companies. They're working within a system that incentivizes medication over prevention. But that doesn't make it right, and it doesn't mean you have to accept it. Here's the reality. The pharmaceutical industry spends billions on marketing to doctors. They send representatives to medical offices. They sponsor continuing education courses. They fund research that conveniently shows their drugs in a positive light. And doctors, who are busy and overwhelmed, often rely on this information without digging deeper. I'm not saying doctors are corrupt. I'm saying they're human. They're working within a system that's designed to benefit pharmaceutical companies, not patients. When you turn 70, your body changes in ways that most doctors don't adequately address. Your kidney function decreases by about 30%. Your liver's ability to metabolize drugs decreases. Your body composition changes. You have less water and more fat, which affects how medications are distributed in your body. This means that a standard dose of a medication that was safe for you at 50 might be too high for you at 70. But most doctors don't adjust dosages based on age. They just prescribe the standard dose. Additionally, your nutritional needs change. You need more vitamin B12. You need more vitamin D. You need more minerals like magnesium and potassium. But instead of addressing these nutritional needs, doctors often just add more medications. Let's talk specifically about prostate health because this is something that affects almost every man over 70. The prostate naturally enlarges with age. This is called benign prostatic hyperplasia, or BPH. And yes, it can cause urinary symptoms. But here's what most doctors don't tell you. BPH is often preventable and reversible through lifestyle changes and proper nutrition. Inflammation is a major driver of prostate enlargement, and inflammation is driven by diet, stress, and lack of exercise. So if you address these root causes, you can often reverse prostate enlargement without medications. The supplement I'm recommending addresses this by reducing inflammation, supporting healthy hormone levels, and providing the specific nutrients that the prostate needs to function optimally. Let me tell you about some of my patients who've made the switch from pharmaceutical medications to a more natural approach. There's Michael, 74 years old. He was on 3 different medications for his prostate and blood pressure. He was experiencing erectile dysfunction, fatigue, and constant urinary urgency. After switching to the supplement protocol and making some lifestyle changes, his symptoms improved dramatically within weeks. He's sleeping through the night, his sexual function is back, and he's actually been able to reduce some of his medications under his doctor's supervision. Then there's David, 68 years old. He was on a high-dose statin and an alpha blocker. He was experiencing muscle pain and sexual dysfunction. After switching to the supplement and working with me on a natural approach to cholesterol management, his muscle pain disappeared and his sexual function returned. His cholesterol levels are actually better now than they were on the statin. These aren't isolated cases. These are the results I'm seeing over and over again in my practice. I'm so confident that this supplement is going to work for you that it comes with a 60-day money-back guarantee. If you don't see results within 60 days, you get your money back. No questions asked. This is how confident I am. This is how much I believe in this product. If you start taking this supplement today, here's what you can expect. Within the first week, you might notice improved urinary flow. Within 2 weeks, you might notice that you're waking up less frequently at night. Within a month, you might notice improvements in sexual function and energy levels. And within 2 months, you should see significant improvements in your overall prostate health and quality of life. But remember, this isn't a magic pill. This is a supplement that works with your body's natural healing processes. It takes time, but the results are real and lasting. While you're taking the supplement, I also want you to focus on lifestyle factors that support prostate health. First, reduce inflammation through diet. Cut out processed foods, sugar, and excessive alcohol. Focus on anti-inflammatory foods like fatty fish, leafy greens, and berries. Second, exercise regularly. Even a 30-minute walk 5 times a week can make a huge difference in prostate health and overall health. Third, manage stress. Chronic stress drives inflammation and hormonal imbalances. Practice meditation, yoga, or whatever stress reduction technique works for you. Fourth, get adequate sleep. Your body does most of its healing during sleep. Aim for 7 to 9 hours per night. And fifth, stay hydrated. But be smart about it. Don't drink a lot of water right before bed if you're already dealing with nighttime urinary frequency. I know some of you are thinking, but Dr. Mitchell, what about my current medications? Should I just stop taking them? No, absolutely not. Don't stop any medications without talking to your doctor first. What I'm recommending is that you work with your doctor to evaluate whether each medication is still necessary and whether the benefits outweigh the risks. Some medications are genuinely necessary, but many aren't. And your doctor might be willing to reduce or eliminate some medications if you present the evidence and show that you're taking a proactive approach to your health. Another common concern: is this supplement safe? Are there side effects? The supplement I'm recommending is made from natural ingredients that have been used for centuries to support prostate health. It's been tested for safety and purity. And unlike pharmaceutical medications, it doesn't have the serious side effects we've been discussing. Here's what I want you to understand. Your health is your responsibility. Yes, you need good doctors, but you also need to be an informed consumer of healthcare. You need to ask questions. You need to understand what you're taking and why. The pharmaceutical industry has done an amazing job of convincing us that more medication is always better. But the truth is, for many men over 70, less medication and more natural approaches would lead to better health outcomes. I'm not anti-medicine, I'm pro-health. And sometimes the healthiest choice is to avoid certain medications and focus on natural solutions instead. So here's what I need you to do. First, click the link in the first comment or in the description and order your supply of the supplement today. Don't wait. Don't think about it. Just do it. Your future self will thank you. Second, share this video with other men in your life who are over 70. Share it with your friends, your family members, your colleagues. Help them understand the risks of certain medications and the benefits of a more natural approach. Third, comment below and let me know, what medication have you been prescribed that you're concerned about? What health issues are you dealing with? Let's start a conversation. Let's help each other. And fourth, subscribe to this channel if you haven't already. Hit that notification bell so you never miss our latest urology insights. We're posting new videos every week, and each one is designed to help you take control of your health. Remember, you're not just a patient. You're not just a collection of symptoms to be medicated. You're a person with a life to live, a body that deserves to function optimally, and the right to make informed decisions about your health. The pharmaceutical industry wants you to believe that you need their medications. But the truth is, your body has an amazing ability to heal itself when you give it the right support. That's what this supplement does. It gives your body the support it needs to heal itself, to function optimally, and to maintain the quality of life you deserve. So take action today. Order the supplement, make the lifestyle changes, work with your doctor, and take control of your health. I'm Dr. Sarah Mitchell, and I'm here to help you live your best life. Thanks for watching, and I'll see you in the next video.